Hello, my name is Dr. Matthew Dacso, and I'm a professor of medicine, a general internal medicine clinician, and the director of the Charles E. Cheever Jr. Center for Medical Humanities and Ethics. I'm so excited to join this conversation about ethics, hosted by our center and the Ecumenical Center this Thursday evening at 5:30 p.m. in the Pestana Hall, right here on the campus of UT Health San Antonio. We live in an unequal world where there is so much need. Around the planet, there are communities where people wake up without enough to eat, where natural disasters destroy people's homes, and where complex issues like violence and conflict, climate change, and global trade shape the conditions that influence people's ability to achieve health. And we all know you don't have to leave the United States to find many of those issues. Neighbors right here in our own community are struggling to make ends meet. Some don't have health insurance or can't access transportation or find work that can pay the bills. It takes a toll. Some have experienced floods or hurricanes or are going through unprecedented drought, which is affecting their livelihoods and thus health as well. And as good-hearted people, when we see those kinds of disparities, we want to help. We want to engage. We want to make things better. Maybe we can look for an opportunity to volunteer or donate some canned goods or make financial contributions to an organization that addresses one of those problems we think needs fixing. Maybe we even decide to join a mission trip and travel abroad or a local community to provide some kind of health service or anything to help us feel like we're making a difference. As you can imagine, doing that kind of work can bring up a lot of complicated scenarios, especially when these kinds of power and resource disparities are at play. Compassion, dedication, and a desire to make a difference are important, but are they enough? How can we make sure that the contributions we're making are actually those that are most needed? While we're seeking to do good, could we actually be doing any unintentional harm? I hope you can get a sense of my talk will focus on some of the ethical issues that come up for volunteers, organizers, and health systems that are looking to make lives better for underserved and marginalized communities at home and abroad. I hope that by taking a careful look at how we do things, this is going to help us have a conversation and develop some skills around how to approach this important work in a way that respects, validates, and prioritizes the needs of those communities that we aim to serve so we can achieve the dream of better health and a better world for all. Please follow the link attached to this message to register. It should be there. And I hope to see everybody this Thursday evening.